Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we're talking about plantar fasciitis. And plantar fasciitis is probably my favorite thing to treat other than back and neck pain. People are always kind of surprised when they find out a chiropractor can help them with their foot pain. And so today we're talking about what Google won't tell you about plantar fasciitis. When I'm researching to do one of these videos or coming up with ideas, I like to take it from the perspective of a person who doesn't know about plantar fasciitis like we do, and they're just Googling for solutions to their problems. And while I was doing that, I noticed that Google talked about a lot of solutions but left out something super important. So today we're going to be talking about that. Stick around. Okay, so to tell you about this often overlooked solution, let's say, to plantar fasciitis, I'm going to walk you through kind of a flow chart of a big overview of the plantar fasciitis problem. So the way plantar fasciitis starts is with a problem with how the foot works. We're going to call that foot dysfunction, but really a lot of things could comprise that foot dysfunction. It could be tight calf muscles that are limiting ankle mobility. It could be a stiff ankle joint. It could be a fallen arch. It could be a really high arch. It could be a lot of things, but something about the foot isn't moving correctly, and that's causing stress to be focused into the plantar fascia. Once that happens, the plantar fascia becomes inflamed and irritated and painful. And that's when people start to notice those plantar fasciitis symptoms. Now at this point, there are two things that could happen. They could either start to try and fix that problem quickly, so like they go to a doctor or podiatrist, or try to change their footwear, something like that, or they just try to power through it. If this inflammation of the plantar fascia goes on for long enough, then it stops becoming an inflammation problem and starts to become a degenerative problem. So the plantar fascia starts to be less like healthy tissue and more like beef jerky, like it's dried out, it's not working right. Okay, so here is where the Google search algorithm comes into play. If you Google plantar fasciitis, it will tell you that plantar fasciitis is an inflammation of the plantar fascia, and it will offer a few different common treatment methods for the problem. It will say things like injections, so cortisone injections into the plantar fascia, surgery where they cut the plantar fascia and just leave it severed, stretches for your foot and calf, night braces to keep your foot in a certain position while you sleep, changes in footwear like insoles or orthotics, things like that. Sometimes I see on Google it mentions physical therapy, but very vague about it. So you could do these treatment methods for some of that inflammation. So like, let's talk about the inflammatory part of the plantar fascia, right? That category. The cortisone injection is good for reducing inflammation. No two ways about it. It will a lot of times eliminate pain, but there are some side effects to that injection. It increases the likelihood of that plantar fascia to rupture by over 30%. It's going to cause some muscle atrophy to the foot where it's injected, and the effects are pretty temporary. So the orthotic, let's talk about that. The orthotics for the foot, they're trying to change the way that the foot moves or the way that force is dialed into the foot, and sometimes that will help with plantar fasciitis pain and start to reduce the inflammation. But it weakens some of the muscles in the foot, the intrinsic foot muscles. Since we're not using them as much because we have an orthotic, those are going to become weaker. And so you kind of become dependent on that orthotic for how good your foot feels, or keeping your plantar fasciitis symptoms gone. And then obviously surgery. Surgery can help people with plantar fasciitis if it comes to that point. We always hope it doesn't, but if that comes to that point, they're literally severing the plantar fascia. It's not going to function the same after that surgery, and the foot is just going to have to live with that. So all of these options can help with plantar fasciitis symptoms, the foot pain, but it overlooks the very root of this problem, the thing that we talked about at the very top of the flow chart, which is foot dysfunction. So Google overlooks the fix for plantar fasciitis, which is fixing foot dysfunction, improving the way the foot works. Other than stretching, which it lists general stretches, calf stretch, it doesn't talk about it. And I think the reason why is because it's complex. like we talked about earlier in the video, it could be a fallen arch, it could be tight calf muscles, it could be stiff joints in your foot or your ankle. There's a lot of things that could cause your foot to not move the way that it should. But the way we treat plantar fasciitis is twofold. One, we find out which category our patient falls in. Are they in that acute inflammatory stage where the plantar fascia is inflamed and irritated, or has it been going on to the point where the plantar fascia is degenerated? It's more like that beef jerky. And then we have to address those two components. If it's degenerated, then we need to spur healing to the foot. We're going to use Graston technique, where we scrape the foot with metal instruments. We're going to use dry needling. We're going to use laser therapy, things that stimulate healing to that beef jerky, worn out plantar fascia that's degenerative. If it's inflamed, then we need to take as much strain and wear and tear off the plantar fascia as we can. We're going to do things like kinesio tape to offload the strain that's going through the plantar fascia. We're going to stretch the calf so that the amount of force going through the plantar fascia that's tugging at the heel and causing that pain is reduced as much as we can. And then we're going to fix the foot dysfunction. We are going to find out whether that patient has a fallen arch, a stiff foot, a weak foot. If they're intrinsic foot muscles, the muscles on the bottom of the foot are too weak and are just putting too much strain on the plantar fascia, we got to start addressing that. Because if we don't fix that, then as soon as those other remedies that are helping us reduce the pain wear off, then the plantar fascia problem is going to come back because the foot is still moving incorrectly. Now, a few last things that I want to say about this plantar fascia flow chart, the situation that I walked you through, is that I'm not saying that injections and orthotics and surgery for plantar fasciitis don't have their place. They do. But what I am saying is that when it comes to treating this problem, we should always start conservatively first. So even in our office, we fit our patients for custom orthotics to help them with plantar fasciitis if we can't get to that underlying root of the foot dysfunction. If despite rehab exercises, stretches, all the things that we do to help the foot move better, if it still doesn't take and that plantar fasciitis is still happening, then we'll fit them for the orthotic. And if that doesn't work, then we'll refer them to someone who can help them with injections or surgery. But it's always better to start conservatively, see if we can fix the function of the foot. That way the patient doesn't have to rely on an orthotic or have to undergo those more serious treatments. So if you have plantar fasciitis or foot pain or know somebody that does, then why don't you come in and let us help you with that problem. Until next time, this has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.